Myth number 1, you're eating for two. One of the most common pregnancy myths is that you need to eat twice as much because you're eating for two. While it's true that you need to consume more calories during pregnancy, the amount you need is not double your normal intake. In fact, most women only need an extra 300 to 500 calories per day during the second and third trimesters. Eating too much can actually lead to excessive weight gain, which can cause complications during pregnancy and delivery. Myth number 2, you can't exercise during pregnancy. Another common myth is that pregnant women should avoid exercise because it can harm the baby. However, exercise is actually beneficial for both the mother and the baby. Regular exercise can help reduce the risk of gestational diabetes, high blood pressure, and other complications. It can also help prepare the mother for labor and delivery. Of course, it's important to talk to your healthcare provider before starting any exercise program during pregnancy. Myth number 3, you shouldn't have sex during pregnancy. Some people believe that sex during pregnancy can harm the baby, but this is not true. In fact, sex is generally safe during pregnancy unless your healthcare provider has advised against it due to certain medical conditions. However, some women may experience discomfort or pain during sex due to changes in their bodies. If this is the case, it's important to talk to your healthcare provider. Myth number 4, you can't dye your hair during pregnancy. There is a myth that pregnant women should avoid dyeing their hair because the chemicals can harm the baby. While there is limited research on the topic, most studies suggest that hair dye is safe during pregnancy. However, it's best to avoid dyeing your hair during the first trimester when the baby's organs are developing. If you do decide to dye your hair, be sure to do it in a well-ventilated area and follow the manufacturer's instructions. Myth number 5, you can predict the baby's gender based on the shape of your belly. Many people believe that the shape of your belly can predict the gender of your baby. For example, a high belly means you're carrying a girl, while a low belly means you're carrying a boy. However, there is no scientific evidence to support this myth. The shape of your belly is determined by the position of the baby, the amount of amniotic fluid, and the mother's body shape. In conclusion, there are many myths and misconceptions surrounding pregnancy. It's important to do your own research and talk to your healthcare provider to separate fact from fiction. By staying informed and making informed decisions, you can have a healthy and successful pregnancy.